can see, I've got palm trees behind me. We're actually in Veronero at a resort here, and it's kind of gray and cloudy right now, but we decided to do a shoot of 8 questions here. Anyways, to my first question in regards to scar tissue, what exactly is scar tissue? It's basically your body's response to a potential injury. And it could be something from an external injury, for example, if you stuck your toe, you fall on your bicycle. It could also be internal, where you can get scarring within your body from potential inflammatory processes. And what happens is your body lays down fibrous tissue to repair any damage that's been caused. That's what scar tissue is. So the difference between healthy scar tissue and dysfunctional scar tissue is this. Healthy scar tissue does not stick onto pain-sensitive structures such as nerves, blood vessels, bones, muscle tissue, connective tissue, so on and so forth. Generally speaking, it's more mobile, and there's less dysfunction associated with a healthy scar. But when you have dysfunctional scars, what will happen is it can latch onto soft tissues such as muscles, connective tissue, bones, nerves, anything that's pain sensitive, and it causes a whole lot of dysfunction, including limited range of motion also, along with spasming and pain. So here's the thing with dysfunctional scar tissue. This is what could potentially happen. You can have a scar that's visibly small, for example, a couple of millimeters, but in fact, when I'm palpating or I'm feeling around the area, it's actually maybe a lot longer than that, maybe a couple of centimeters to maybe a few inches. It can also run deep, and it can also run wide. And when that happens, it can latch onto structures around the area, especially connective tissue, that can cause a lot of spasming and a lot of pain. So what can deep tissue massage and acupuncture do in regards to dysfunctional scar tissue? Well, for one thing, it can help decrease the pain by mobilizing the scar, making it more supple, more flexible, allowing for more blood flow into the area. Because what happens is when scars are very tight, it can press down on structures, decreasing potentially the blood flow in the area to assist with healing. It can also decrease the amount of spasming that's occurring in the area, because if a scar is, say for example, stuck to a nerve and pulling on it, causing irritation, it can cause spasming in and around the muscles in the area. So those are some of the things that massage therapy can do, and also it can also help decrease potential swelling in the area if there is scar tissue around the region, because what happens is if the scar is very, very stuck, it can decrease the amount of flow in and out around the area. When I mobilize the scar tissue, there's an increase in flow in the region. So a prime example of one of the cases that I've worked on is basically somebody who's had a scar that's on their hip because of hip surgery. And what happens when the scar tightens up, this individual tends to find hip pain, back pain, even spasming all the way down into the foot. So by me relaxing the person's scar, by making it mobile, there's a decrease in spasming down the leg, and also a decrease in pain and tightness in the lower back and hip area. One of the things that I mention to patients in regards to surgery is that they should prepare for post-operative procedures in regards to rehabilitation. So, for example, somebody who might have knee surgery, I encourage them to get a consultation with a professional such as myself to see what their opinion is in regards to when they should start doing scar tissue work. Usually you want to do scar tissue work when the tissues are relatively healthy, where they're not brittle and potentially weak after surgery. So there is definitely a time frame when it's optimal to work on the scar tissue. So I've had a number of these cases where a person comes in because of chronic pain, for example, chronic pain in the knee, chronic lower back pain, chronic hip pain, so on and so forth. I do the treatment, they feel a ton better. One of the first questions they usually ask me is, how come my doctor has not referred me to a potential therapist who can help with the scar tissue? A simple answer is basically doctors don't have the training in regards to actually feeling around the area and seeing how mobile the scar is. Myself, as a massage therapist, I have a lot of experience, and not just myself, but chiropractors, potentially physiotherapists. We have a lot of experience in terms of feeling things around a particular body part to figure out whether something is dysfunctional or not. That's basically a simple answer to why they don't feel hurt. Okay, so do I have experience myself personally in regards to my own scar tissue? In fact, I do. So if you take a quick look at my shoulder right here, there's a big scar that I have here. That's one scar that I have on this particular shoulder. Now this was from a surgery that I had removing the mole. So if you notice, the scar is fairly big, right? Fairly big, thick and wide. Initially it was a lot thicker than this. The other scar I have is this. If you'll notice, I'm just going to pull this up. You notice there's a bit of a dip when I do this. There. Okay, I tore my pectoral muscle way back, maybe about 8 years ago or so. So this shoulder has had a lot of scars and scar tissue in the area. This one, the torn pectoral muscle, a lot of it was internal, so it was causing things such as pain, maybe spasming. So what I did was I basically had to mobilize myself. I did my own mobilization on the scars, on both scars here, and this one, to help decrease some of the pain, dysfunction, range of motion issues, so on and so forth. What I found also is that when the scar was tight, it caused a lot of pain around the neck, around this area here. Now it's quite mobile. It's still not as strong as my right side, but in regards to whether I have experience with scars, I have my own personal experience to go with in regards to teaching people what scar tissue work can do and what dysfunctional scars can cause. Anyways, this is Alfie here in Verde, Cuba at our resort, and I want to say thank you for watching this video. Have a good day.